My name is Bixing Fang. I'll introduce the paper submitted to iMeta. The title is Stratification of Chronic Rhinosinusitis with Nasal Polyps by Distinct Sinonasal Microbial Communities and Their Clinical and Pathological Correlation. Chronic rhinosinusitis or CRS is a complex, multifactorial inflammatory disease of the upper airway. Studies have shown that the sinonasal microbiome plays a key role in CRS, with reduced microbiota diversity, or microbial dysbiosis, being a common feature among patients. It has been proposed that CRS patients could be stratified according to specific sinonasal microbial compositions, illuminating phenotypic heterogeneity. This study aims to identify sinonasal microbial communities in CRSwNP patients, categorize them based on microbial phenotypes, and explore associations with clinical and pathological characteristics. The focus of this paper mainly includes 2 points. The first is to distinct sinonasal microbial community subtypes, CT1, CT2, in CRSwNP patients were first identified via 1,6S RNA sequencing, dominated by Corynebacterium-related and Streptococcus-related genera respectively, with significant differences in microbial diversity and inflammation-associated metabolic pathways. The second is microbial community stratification strongly correlates with CRSwNP clinical pathology. CT1 links to severe disease, higher eosinophil infiltration, and CT2 to a mild phenotype. Validated by an independent data, this stratification provides a key microbiological basis for tailored therapies. Results 1 show to distinct sinonasal microbial community types in CRSwNP patients. Figure 1 show unsupervised clustering approach using the Dirichlet multinomial mixtures model revealed to distinct microbial community types, CT1, and CT1 showed significantly diminished microbial diversity and richness compared to CT2 in control subjects, with the control group exhibiting the highest diversity and richness. This suggests that the microbial environment in CT1 patients may be more prone to dysbiosis, and the functional potential of the microbiota was predicted using the pie-crust algorithm. These findings suggest that CT2 harbors enhanced anti-inflammatory and antimicrobial functions, whereas CT1 microbiota may contribute to a more pathogenic state. Result 2 shows validation of a predictive model based on nasal microbiome typing and its corresponding clinical and pathological features. First, validation cohort samples were clustered independently without prior model training, and then a semi-supervised clustering approach identified to subtypes. Cluster 1, dominated by Corynebacterium, resembled CT1. Cluster 2, enriched in Porphyromonas, Bacteroides, and Streptococcus, mirrored CT2. Higher CT scores and eosinophil levels were associated with Cluster 1, validating the clinical and pathological characteristics observed in CT1 and CT2. Finally, we summarize this article first. CRSwNP patients can be stratified into 2 distinct microbial communities, each with specific clinical and pathological profiles. Then, microbial-based stratification may inform tailored therapeutic strategies to address the diverse clinical and pathological manifestations of CRSwNP.